under the influence of progesterone or early in the cycles when there is no estrogen, then the sperm are blocked. So this is the physiologic principle behind the effectiveness of natural family planning. Basically that when mucus is present, there's fertility. When mucus is absent, or and that's going to be when there's high progesterone, no sperm can get through. Without boring you with details, that's the only slide of mucus that I'll show you. When it's all put together, what we have then is these changes of estrogen and progesterone that you see here, in terms of estrogen rising, paralleling the cervical mucus that one sees, and then the rise in progesterone in the second half of the cycle. I modified my slide probably for your benefit. You might use this, I don't know, perhaps, but Bill Keane in the Family Circus, and when I do something wrong, please help me to wipe that smile off my face. Think of that last night as I came home, and my fifth child was in the shower, and we couldn't figure out why the water was running and running and running. And I finally went upstairs and asked him, but he was taking a shower, but the tub was also stopped up, and the water was really at the brim of the tub from the shower. I suspect each of you have had stories like that too. Okay, approaches to conjugal intimacy. How can one approach that which Father just discussed? The mechanics are behind this now. Couples use NFP, or actually one approaches one's conjugal intimacy in different ways. In the world today, contraception is clearly that which is predominantly used. One can use natural family planning. One can come to one of these courses, one of the courses, the marriage prep courses, and they hear from the NFP teachers or the marriage prep people that they have to use NFP. Well, they see it sometimes simply as another method of family planning. They approach natural family planning really from that contraceptive mentality. And that's okay if they were going to be going into marriage with the thoughts of using contraception. There are times when natural family planning can be used to avoid pregnancy for serious reasons. And that's really what the Holy Father asked us to do with respect to creating these methods. That's what Humanity is all about, that we are called to be open to life, as Father elucidated. But there are times when there are medical reasons when one may not want to bring life into the world. We're called to be responsible parents. And whether it be their illness of the mother, of the father, financial concerns, moving concerns, job concerns, those are all that situations that, in those of you that I've worked with in the office, I have to lead between the husband and wife and father. That's a discussion that as a physician cannot enter into. In my mind, I can never tell a woman to conceive or not to conceive. That's a decision between husband and wife. But when there are serious reasons, at least we have a method, and my job then is to work with couples to assist them to let that be effective. One can use NFP to achieve pregnancy. We do that with infertility. There are other medical reasons that I would use it, and that's really what I'm going to be going through here in a little bit. I've also had women come to me who state that they don't want to learn NFP simply because they don't want to know too much. They want to be totally open to God's will. And I truly respect those couples. I simply, many will go through the class and then not chart, and some would ask not even to go through the class for that reason. From a book called The Furrow, you will find people who, because of their dull stubbornness, will be very difficult to convince. It is worthwhile clearing up discrepancies and clearing them up with all the patience that might be needed. And this is written by one of the more recently canonized saints of our church, but it's the approach that I have to use in dealing with some of my colleagues sometimes, and what you will need in terms of discussing with your parents, your grandparents, your siblings, as you discuss with them why you're using an FP or why you're being open to life, and they're saying, well, don't you know that can be fixed. How do oral contraceptives work? 95% of the time, they block ovulation. They thicken the cervical mucus, and I can't quantitate the number there. But 5% of the time, they actually thin the uterine lining. Now, some of the other forms of the pill, the very low estrogen forms of the pill, can block ovulation less often. But even though they block ovulation less often, they actually thin the uterine lining a little more effectively. And that becomes important because they are, quite honestly, work with a different mechanism of action. To block ovulation, the thickened cervical mucus blocks conception. It's contraceptive. If you thin the uterine lining, the little baby trying to implant can't, and it's really abortive. Contraception, barriers, chemical sterilization, they really separate those unitive and procreative aspects of one's life. They separate life from love. And in the interest of time, I won't dwell on that one again. So the Creighton model is one approach to that. In it, the effectiveness rates clearly are in the high 90s. And if I look at all the different methods of family planning, they are in that neighborhood in terms of how effective are they to assist a couple to avoid pregnancy when that need is there. One has to look at how they're used. Basically, there's a difference in medicine between the method and use effectiveness. The method effectiveness, if you will, from a birth control pill perspective, would be you take the pill every day. The use effectiveness, you may have forgotten to take it one day, or the condom broke, if you will. With natural family planning, one can look at the method and use effectiveness and deal with, have all the observations been made? Did the teacher teach you properly? As opposed to the other methods of family planning, where they, by their very nature, are designed to avoid pregnancy. NFP can also be used to help couples to achieve pregnancy. And that's the area of infertility that we look at. And I'm not going to focus on that today. Other than to state that in couples trying to conceive, by 3 months of fertility-focused intercourse, 90% of people will conceive. And by 6 months, nearly all of them will conceive. Caveat is that if they have normal fertility. Bottom line is, if you haven't conceived in 6 months, there may indeed be an issue there leading to, they're pointing to and illustrating a problem that needs to be addressed. Let's see. Okay, Dr. Hildress has been the pioneer that basically I trained with. And his key thing was that he standardized the observations. And basically, after looking at thousands and thousands of charts of couples using this method to avoid pregnancy, the realization was that there's a lot of information in terms of these various disease processes. And it led to, and I was there with him when he was putting all this together in the early 90s, this whole concept of NAPRO technology, natural procreative technologies, which represents the science devoted to using medical surgery and all of the support systems to cooperate with God's natural design, the natural procreative mechanism and function. It's safe, respects the dignity not only of the woman but of the couple, both, effective, and it's built upon this working understanding of the Creighton model. My approach is that I use it in all these different medical areas, whether it be infertility, miscarriage, cysts, irregular cycles, hormonal problems, unusual bleeding, PMS. And basically it works hand in hand. The NAPRO technology and Creighton model go hand in hand. There are times when I will use Creighton to help deal with, if a couple's not charting Creighton model, I don't not see the patient. I mean, but other methods don't sync as well in terms of this whole concept of NAPRO technology, because they really don't allow us to get to the medical nature of the problem sometimes. They're very effective in terms of the method of family planning, but they may not be as effective from a medical perspective. A normal cycle of estrogen, progesterone rises, and the mucus that might be present. And by contrast, we see a very, very short second half of the cycle here, illustrated by very low progesterone levels. So when we see this on the chart, we can identify the very low progesterone levels and maybe do a blood test to look for that. And that's what we see with PMS, quite frankly, and some of the other, if you will, issues, bleeding disorders. Premenstrual spotting, as a result of those low progesterone levels, we see that frequently, of bleeding actually just before, it's actually brown spotting before the period. Many times we will see brown spotting afterwards. Ovarian cysts can be treated. Postpartum depression can be treated with in the same way. And various types of discharges can be treated very effectively. Again, my goal isn't to go into all of that in great detail, other than to deal with some of these very specific cases that I'm going to review. For the couple attempting to conceive who has difficulty, the conventional approach is to identify some of the factors. Sometimes there's an assessment of those. Commonly, the patient is placed on Clomid, leading to some other medications that might be used, or intrauterine insemination, artificial insemination. And the hallmark of treatment for in the conventional sort of way right now is IVF. 2 of the 3 couples that I saw that had driven in from Chicago yesterday had IVF. And one lady, she had had a miscarriage. She talked about her miscarriage. And she talked about, and I asked her, did you name that child? Did you name that baby? She had not. But when I went further, she had 24 eggs be harvested. Of those 12, there were, she described 12 eggs that she had. Really, she had 12 children. And the realization was that she still viewed those as eggs, per se. But there were 12 children that were conceived through that process of IVF. I believe about 5 or 6 of them had been transferred. Only 1 actually took, and that child was lost through miscarriage. A totally different approach to treating infertility with NAPR technology in that we begin with charting, we look for hormones, ultrasound problems, the medical problems, treat the specific problems. I discussed in this that I use this term sometimes, that I see myself as a mechanic, to fix the problem and then allow the couple to co-create that child with God, but it's not my role. But my role is to treat that organic disease and then cycle by cycle to evaluate it, and quite honestly to realize that there are some times when even with all of these technologies that life will not be achieved. And adoption is actually a critical part of this whole process of NAPR technology and the evaluation of an infertile couple. Each child is viewed as a gift. You know that. Dona Vitae, 1987, the church's teachings on infertility. It was written by, anyone know the author of it? You don't count. Pardon? John Paul II. No. Somebody that knows him, though. Gentleman with a red hat at that time, who was prefect of, I forget the name.
Congregation for the Doctrine of Faith.
Thank you. At that time, and as you know, he doesn't wear a red hat anymore. So the other document, in addition to Dona Vitae, that we have at our disposal to look at the teachings of infertility is a document released in 2008 called Dignitas Personae. And that probably was written by the Holy Father, or at least he had a part in it, in follow, although his name's not on it, to my knowledge. But I prescribe this for all of the couples whom I deal with respect to infertility, and ask them to actually look at it. Because it talks about IVF, it talks about assisted reproduction, intrauterine insemination. And it's a radical change in terms of what my profession does right now. The goal of the evaluation, as I said, is to treat the underlying condition and not to replace the role of the husband and wife in cooperating with God. I'm not going to go through these details in terms of how we approach it in terms of that whole approach, but just one thing to comment on. This couple that came in from Chicago, as I said, they had all of their records. I mean, there's a huge stack of documents, and this is why I get behind. When you bring a book, and we're supposed to do it in a 15-minute visit. Okay, and you guys are up and waiting. What's Dixon doing? And the poor receptionist is in the fishbowl going through that glass. Get in your eyes. But anyway, also brought in the seminal fluid analysis. And in looking at it, I always ask, well, how is this collected? And yes, the standard approach is that the gentleman's given a cup and asked for a specimen. Commonly nothing is said after that, but you're in an exam room and not the bedroom. So it's actually the standard approach to obtaining is through masturbation. You realize how difficult it is to get one of these tests done even in St. Louis? When one of the reports I had that came back from one of the hospitals, I believe unnamed, but well, the way we do it is through a perforated pouch. It's actually a seminal fluid collection pouch that doesn't disrespect the integrity of the husband and wife of the marriage. And so the husband and wife can collect this at home and get it to the lab within 30 minutes. It always creates a great story is what happens if you get pulled over by the police, I guess, in terms of getting this specimen in 30 minutes in the lab. But anyway, the report from one of these hospitals came back is that it was submitted in a condom. It always says condom. It's not a perforated pouch, but it's actually not a condom because condoms have spermicides in them and all sorts of other things. Latex as well. These are made of a silastic material. But it said collected improperly in a condom, not a valid specimen. And so even our whole medical profession won't even interpret it that way. And one of them just refused to give me a result as a result of this, quote, improper collection. Couples with infertility have limited mucus, or no mucus at all, or very short second halves of the cycle with leading to recurrent miscarriage, or sometimes very normal mucus cycles when there are tubal problems, if the woman's tubes are blocked, or if there's an abnormal sperm count. So the chart itself can allow me sometimes just to identify the actual causes of the infertility. So that which we do from a surgical perspective, and it's different than the typical hysterectomy and endometriosis perspective, but it's what we do from a NAPR technology perspective, and it's really looking at GYN surgery also in a radically different way to reconstruct the uterus, tubes, and ovaries. Did a case on Tuesday, a 6-hour operation of a lady who had just one big mass of uterus, tubes, ovaries, intestines, bladder, everything all stuck together, and pain and infertility. And she had actually she only had one ovary because her previous operation 4 years ago, she went in and it was one of those where reading the operative report, because it sounds like a complex procedure, but the report said that we incidentally removed the right ovary. That's actually in the report. It was incidentally removal of the right ovary. And actually what happened is that it was such a complex operation that they probably snipped one too many times and realized in trying to remove the abnormal tissue, they had actually removed the entire ovary. Wouldn't have phrased it that way, but anyway, it sometimes takes a major reconstructive effort to preserve the uterus, tubes, and ovaries. patient came in, I just saw her this week also, and she was actually delivered some time ago, but she also had had surgery previously, dealing with endometriosis, and couldn't conceive, was told that her surgery was all treated. It was a scenario, and I'll try to summarize this very quickly, but after a long process, we reoperated, went through several months actually of treatment. Her brother was actually a seminarian, or is a seminarian, and knew Cardinal Burke, and actually he had made arrangements to have her meet him up at the shrine, his shrine up in La Crosse. And she went up there, met with him, paid a visit to the Shrine of St. Gian up there, and then came back. And so he, in meeting with them, said what she was doing, and he told her, be patient, you will conceive. Well, as it turns out, later comes to see me. I hadn't seen her all along. And when she came into the office, just in terms of this infertility evaluation, I was looking at her hormone levels, and they were quite high. And she was describing not feeling well, and she had some chest pain. And I'm hearing this, I thought, oh my goodness, this lady's pregnant, but she was still charting. She had no idea that she was pregnant as I looked at her chart. And it seemed obvious that she was, but we did a urine test, it was positive. I didn't tell her that. Took her in to do an ultrasound to look for these ovarian cysts that she'd been having. I was able to show her not only her ovarian cyst, but this fluid-filled structure in the uterus that actually had a little baby in it too. The interesting thing was that when we went back and looked at her chart, then in terms of going back in time, and this was probably 10 minutes after the tears had stopped flowing on hers, we went back, and because she didn't know she was pregnant, but we went back and looked at the chart, and I said, where were you guys about this time? What was going on? Well, it was the very day that she met with Cardinal Burke. And she describes the specific hotel in room 111. But she was at the shrine. The baby's name was Gianna, or is Gianna. Okay. Again, I'm not going to go through all this. NaPro can be used to treat many conditions, and it is basically what I do. Whether we laser endometriosis and get rid of that, which has a negative impact upon fertility, or even then carrying forth to, as I just described, dating pregnancies. That one was pretty easy because she told me about room 111. Here's an 11-week baby that matches all of your literature on the back table there. That was this summer's little getaway with the family. Okay, so what resources do we have to go through and understand about human sexuality today? There are many. We have magazines that talk about what 2,057 women and men did in bed last night. Father, you can use this in your talks. All sorts of things there, and all sorts of things here. This is what we see, though, in our culture. This is what Desperate Housewives and all of these other, our whole perspective on human sexuality is, as Father elucidated, looks at life in a turning inward perspective. There are many resources that one can look at. One More Soul, the Institute, the Couple League, Patty Schneier. Patty Schneier is here in St. Louis. She is actually, if you will, has studied under Christopher West, and somewhat look at her as our St. Louis's own Christopher West, so to speak, in terms of, but she does it from a feminine perspective, and those of you that have heard her understand what I'm saying. I would encourage you maybe to let her come down here and give a talk. Life Decisions International is a group that also looks at this whole culture of death that we live in, and it's basically an organization that looks at organizations that support the culture of death. which, from a financial perspective, from a social perspective. In other words, which corporations are supportive of Planned Parenthood. So in fact, their website is fightpp.org. But and Johnson & Johnson, for instance, is one of the ones on that bad list. You would think Johnson & Johnson's the baby products, but Johnson & Johnson is very supportive of Planned Parenthood. And so it's a way to, in a consumer society, which we need to be, is to make good consumer choices. So LDI is a good organization. Father McCaffrey from NFP Outreach will be actually speaking at the convention down at the Pro-Life Convention later this month. He's from Oklahoma City, but he'll be coming in to speak. Actually, I've gone out to give talks with him before, and I know at the seminary you have talks on how to give these lectures, these homilies on natural family planning. The very first talk we went out to give, he goes into the parish, does the masses, it allows the pastor to get out of town for the weekend. Makes it easy on him, I guess, sometimes. But and I give the talk, but the very first homily he gave, he started the homily out, is that, quote, there are 4 things certain in life: death, judgment, heaven, and hell. And we're here today to talk about contraception. And probably wasn't the approach that, it's not the soft approach, but it certainly got everybody's attention. Okay, quickly going through, where were we with time? We're okay. Okay, that lady, the young college student with left lower quadrant pain, well, quite frankly, it could be that she's ovulating. And there are some women, the rupture of the egg through the surface of the ovary causes pain. And that can be treated sometimes just with progesterone, if indeed, in a cyclic basis, that pain is so severe that it's debilitating. For most women, it's not. For most women, it might be an hour or 2 of discomfort, sometimes pain, but if need be, it can be treated easily. R can actually be a cyst that's forming. So pain, one-sided pain in a young woman at mid-cycle can be usually treated very nicely. Common treatment is birth control pills. It's not what we do though. Okay, what about that high school senior with severe cramps? It's probably endometriosis with severe cramps, it is. And it can be treated sometimes with progesterone, anticipating when her cycle is going to be. We can simply teach her about her chart, her ovulation process, and sometimes laparoscopy surgery to take care of that will assist her greatly. What about Sister Mary, whomever, brought in by Mother Superior, who has this severe PMS? I saw, a privilege to see many of the good sisters in our community. One is, that I just saw this week, brings in her NFP charts all the time. So there she is, charting her cycles. She was commenting upon one of her sisters, who's being treated by Dr. Pilders now, who's being treated with HCG. So instead of progesterone to treat this PMS, which is the most common cause, the sister was being treated with HCG, which is the pregnancy hormone. It helps estrogen and progesterone. The downside, though, is that if indeed she gets hauled into the emergency room, she's going to have a positive pregnancy test. I discussed that with her, perhaps in a prudent way, and the other sister knew that. She needs to declare that before they do her pregnancy test. But my point is, PMS can be treated very nicely with both progesterone, HCG, and some other agents when needed. The 41-year-old mother of 5 who knows what is happening. I sometimes look at that positive pregnancy test, and Marie Billette, who was here, talks about this in terms of her perceptions of pregnancy. When was she here, Michelle? How long ago was that?
I wasn't here when she came.
10 years ago?
Yeah, I've only been here 8, so it's before then.
11.
You have heard her, if you haven't, it's a phenomenal, she is a tremendous songwriter.